All right, welcome everyone. My name is Dr. Jen O'Sullivan. I'm a board certified doctor of naturopathy, and I'm going to be sharing with you some of my favorite things on helping you and your loved ones get healthy. It's an interesting thing because I'm really excited about this. And what I mean by that is I took my entire practice and shifted it into one main modality. So some of you know me as the supplement queen. I love helping you understand herbs and different roots and things to help you get better. And I help you understand where to place those supplements when it comes to pharmaceuticals and coffee and, how to make your health, how to optimize your health regimen. But in the case of when I found this one modality about 18 months ago, it literally changed everything. And what I mean by that is so much so, it had such a tremendous effect on my own clients' well-being, as well as my own and my family's, that it made sense for me to focus on this one modality. So I still help people with essential oils, and I help them with their supplements, and I help them with their lifestyle changes, because as naturopaths, we really want to look into all of the basically 11 to 12 areas of your life to make sure that your foundations of health are good. But when I found this, and again, this was part of my training as well, was phototherapy, but in the plug and play sense, right? You plug it in, you use it. There's different light therapies out there, and medically they're amazing and they work really well. This is something that is absolutely changing the landscape of the community that I'm in. It's changing everything for a couple of reasons. One of the biggest things for me is I don't like overtaxing my liver. And so many of you hear me talk about a supplement, and you think I need to add it. Oh, I'm going to talk about another supplement, I need to add it. You just keep adding supplements, and lo and behold, you're on like 30 different supplements, and you're not understanding which one does what, and you don't really know why, and you just like, somebody told me to do this, and I need to do it. And your liver's not happy. Also, essential oils, the same thing. Some of you are over consuming essential oils. You were told to add a couple drops into your water, and that tasted good. And now all of a sudden, I'm drinking my water and I don't really taste it anymore because you've sort of killed your taste buds. So you start putting, 20, 30, 40 drops of essential oils into your water, and you're again overtaxing your liver. I've seen people get liver toxicity from doing that. I've seen people landing themselves in the hospital, right? It's like it's like the supersize America here. We tend to overdo things. So part of the benefit of what I'm going to show you is that it's non-invasive. And what that means is it's something that you can use to help many different areas in your health, to help yourself without overtaxing your body. So really anyone can use this. There's very few issues that people have, and when they have an issue ever, it's because they haven't hydrated well. We want to drink 4 to 5 ounces of water every 30 minutes. It's not a huge amount of water every hour on the hour. It's 30 to 40, every 30 minutes you want to drink 4 to 5 ounces. Okay, that's proper hydration. So really you should be taking a sip every 5 minutes, or 2 sips, every 10 minutes, something like that. Just start getting in the habit of drinking more water. And another thing that we've found is people are very imbalanced with their electrolytes. So I'm not asking you to buy all these other things. I'm saying I want you to consider your eating habits, your electrolytes, because what I'm going to help share with you today is mind-blowing. Are you ready for it? Because it's really phenomenal. Okay, so I want to just get into the understanding of aging, okay? And when we get into understanding aging, you can see as we age, I'm 50 years old. And, I feel like I've done a pretty good job. I have very fair skin, so I've been burnt a lot. I have very dry skin, so I'm constantly putting lotion on. But at the same time, early on, I learned about essential oils, so I think that was a benefit. But one thing I noticed in this last year was how much stronger my skin is, how much stronger my nails are. How my body seems to be reversing in age. And I don't mean that figuratively. I mean that from the perspective of the décolletage here. You know, I would wake up and it's a wrinkly mess. It's gone. It's totally smooth. You know, when I look at my face and just my skin and the suppleness of it and the collagen production, I was taking so much collagen, I don't have to take any of it anymore. Because when you take human collagen, you can't take human collagen. Did you just catch what I said? You can't take human collagen. Your body needs to create it on its own. But we try to take like collagen from other animals and, you know, we're trying to kind of supplement and it doesn't work. It's like supplementing with vitamin D. Your body doesn't quite know what to do with it. So when you age, what's happening is your stem cells they go dormant. Okay, so some of them go dormant and some of them mutate. When you get a wrinkle, when you start getting gray hair, those are mutated, or if you get cancer, right? That's mutated stem cells. We don't want any of that. That's part of the aging process. This is why we have organ challenges and body aches. When you heal better, the faster you heal, the more stem cells you have. The slower you heal, the less stem cells you have. So some of you understand this. When you're you know, young and healthy, you have tons of stem cells. That's why you heal faster. By the age of 30, some of you started feeling that decline because your stem cell activity, the healthy ones, actually declined by 60% in your 30s. When you reach your 60s, they decline by 90%. These are staggering numbers. So I want you to think back to when you were younger and imagine what it would be like today if you had the amount of stem cells you had back then. You might have never even thought of that, but that's what is happening in your body. This is why we're aging. So I want to share with you something that's patented. Nobody else on the planet has this. And I want to be clear with you on this because a lot of companies have these Me Too products, or they have some sort of drink you can take that can help your stem cells, or they have some sort of supplement you can take. They don't actually increase your stem cells. They just help your body do better. Okay, and so anytime you can do better, like when you fast, fasting has shown to actually increase stem cell activity. But again, you got to be good at that. You got to be regimented, and it's a stem cell increase of a small amount. Now, this is a patented product that activates the dermis of your skin using your own body light. It's infrared light, and it's reflecting back. So I'll show you a patch here. It's reflecting back from this crystal lattice that's inside the patches here. And I can put this on pretty much anywhere. And this is going to start right now reflecting my infrared light, and it's going to reflect back a very specific wavelength that triggers peptides. Okay, and in the case of this patch that I'm wearing, it's triggering GHKCU copper peptide. All right, so what is copper peptide? Right, like I've talked about it for a while now in my different platforms online. And copper peptide, they did a double-blind test published in the Internal Medicine Research Open Journal, and it showed a significant increase in copper peptide concentrations in the blood of the people who had worn X39 for just 1 week. This is a big, big deal. So when you start to understand what peptides do, because of the copper peptides, right? So copper peptides, when you're able to have specifically copper peptides in the GHKCU, and we're going to get into the amino acids of that in just a minute, this can give you upwards of a 2,100% stem cell proliferation rate. Now that's a kind of a false number to you mathematicians. What that's saying is a baseline of stem cells, right? Like if you were to take, say, vitamin C, and that vitamin C, you know, you had a baseline. What is the daily percentage you're supposed to have? But then you took 2,100% more. You're just taking more than the baseline. So what happens is this is going to take your baseline stem cells and proliferate them by upwards of 2,100% in just 4 to 6 weeks of wearing this. This is working systemically all over your body. So if we just understand the stem cell industry, it's not FDA approved, it's not regulated. Doctors are treating their patients at the risk of losing their license and practice and going to jail. It's very expensive. And guess what? When you get stem cell therapy, it only has a 30% reproduction or proliferation rate if it works. So it may not even work. And so that's why they say you need, 3 or 5 different rounds. Well, it's anywhere from $5,000 to $25,000 per injection or per treatment to get potentially a 30% like proliferation rate, lasts about 1 year in your body, but only in one localized spot. So if I had a frozen shoulder or had an injury and I wanted to do some stem cell therapy, we're talking upwards of $75,000, if not more, in one localized spot, hoping it works. And if it does, you're only going to get about a 30% return. So in this case, it's completely different. I'm wearing something that's super affordable. This only costs $100 a month. And before you say, I can't afford that, I want you to understand something. I got rid of almost $400 before tax and shipping, so over $400 of supplements. I still take normal supplements, vitamins and minerals, but all of my hormone supplements going through menopause, I no longer need to take. All of my supplements for my joint issues, right? I'm very, very inflamed. All of them gone. I don't have to take that anymore. It's about 10 or 12 different supplements, and doing the math on that, and no more collagen, all sorts of things I don't have to take anymore. That's a huge savings for my liver, but also for my budget. And when I look at the doctor bills, my astigmatism has completely reversed. I don't have an astigmatism anymore. I've had this practically my whole life. And as an athlete, I have a hard time with that astigmatism because, if I'm wearing